Hello everyone and welcome to Ayush TV Global. Today I'm going to discuss about one of the most discussed topic, which is about HMPV, human metapneumovirus. What is it? The definition of that, and why are people getting scared of it, and how are we going to tackle it? All these things I would be discussing. So firstly, about the definition of HMPV, human metapneumovirus. This is as good as our COVID virus itself, and it affects the respiratory system as well. But the virology is little bit different, and this was discovered very much earlier itself. So these days it has become prevalent, especially in the kids, when we saw some of the cases in Bangalore and other parts of India also. Now coming to the spread, how does this virus spread? This spreads through the respiratory droplets. Respiratory spread is through the droplets, wherein if a person who is infected with HMPV, human metapneumovirus, which basically affects the respiratory system, if he or she coughs or sneezes, and then if that virus is there in that droplet, it gets dried up, and then through the air, it can spread to a person who is having low immunity. So this is one of the important thing which we have to note down. And then coming to the clinical features, if one has been affected or afflicted with this respiratory infection of HMPV, initially it would be cold and cough, followed by sore throat and fever. So this may persist for around 3 to 7 days, which is as per the reports. And then in some people, the recovery time may be a little bit higher, and it may go up to 2 weeks also. And then when it comes to the testing, the same swab testing itself is applicable for this kind of virus, that is HMPV. Then when we see about the precautions, which is very important part, the first and foremost thing is the face hygiene, mouth hygiene, and hand hygiene. So it's very important that we keep washing our hands. And then when I tell about this, many people complain that, no sir, if I keep washing my hands, then it will be a kind of compulsion. So in this case, yes, you have to do it for maybe few days, few weeks, or few months till we tackle the HMPV. And then once it is no more existing, or once we tackle it successfully, then I think we can switch back to our normal routine. So hand hygiene is very important. We have to wash our hands frequently if we touch any of the surfaces, especially the contaminated surfaces, or if we are into the crowds wherein people have cold, cough, or fever, then definitely we have to make sure that we wash our hands. Then the second thing is about the face hygiene, wherein we have to wash our face also, and then unnecessarily we should avoid touching our faces with the hands. This is the second thing. In coming to the next point, it is about avoiding crowded places, and this can be any of the gathering, any of the function, festival, or any of the kind of exhibitions. So we have to usually avoid it so that the transmission is reduced. And then if we feel sick, especially flu kind, that is cold, cough, fever, then it's better we rest at home and take adequate amount of fluids, and then take immunity boosting foods, which I will be talking about this in the next part. And then when it comes to the food, it should be very much hygienic and prepared at home, and it should be warm and fresh, and it should be light. So when I tell about this, it can be a simple chapati or rice or dal, and then it should be very warm and freshly cooked, very important thing. And when it comes to the herbs, which we talk about, especially to boost the immune system, it can be tulsi, it can be the giloy or the tinospora, or it can be st modu, which we quote in Ayurveda frequently. So all these herbs we can use on regular basis in a desired quantity. That will definitely help us to boost our immunity and keep our immunity at optimum level. And then frequently or regularly, if we are catching cold, cough, then it's better we keep using honey with pepper or ginger. So this would also be helping for us to keep the immunity at the higher level. So with this, we can definitely tackle HMPV, which is human metapneumovirus. And since it affects the respiratory system, that's why the term pneumo, which stands P is for pneumo, that stands because it affects the respiratory system. So we have to keep our respiratory immunity higher in order to avoid this kind of infection. Also tackle it if we have already caught this kind of viral infection. So this is all about HMPV, and keep watching Ayush TV Global for further health updates. This is Dr. Sharad Kulkarni signing out. Until I see you next time, take care. Bye.